Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. All right, Luita, tell me what's going on with your hip. What happened?
Oh, I fell down in 2012. I hit my left
2012.
to 2012, yeah.
Yeah,
And
that's
then
8 years ago.
Yeah, I had a fracture in my two toes,
You did
the
fracture.
fourth and the
Okay.
fifth toes. Then I have a cast. I have
Okay.
a physical therapy.
Uh-huh.
The physical therapy helped.
Okay.
And then later on, I experienced having a lower back pain.
Okay.
My chiropractor did a X-ray, said that my lower back is bone to bone.
Okay.
There is no more cartilage in between. That's why the pain is radiating to my left hip.
Okay.
The pain is like 5/6, 5 to 6.
5 to 6
when
from
I'm
0 to
sitting
10
there.
scale.
Yes.
What kind of pain? Is it sharp, dull, aching? How you describe it?
It's stabbing pain.
The stabbing pain. Okay.
Yeah.
Uh-huh. So this, like, for the last 8 years you have issue with your back, with your hip. What else? Briefly.
Right knee, it's hurting.
Okay.
And also my left knee is hurting.
Okay.
And then I have some numbness on my thigh and legs.
Okay.
Some muscle cramps.
Okay.
And also my neck
Uh-huh.
is stiff.
Neck stiffness. Have you seen anyone else other than the PT and chiropractor?
I saw a orthopedic surgeon.
What did
and
he
the
say?
orthopedic surgeon told me I need a hip replacement and knee
Left
replacement.
hip replacement.
Here.
And which knee replacement he recommend? Left or right or both?
Right.
So he wanna replace your joint. Okay.
Yes.
All right.
I told him I don't want to do that. I want to
Mm-hmm.
try the PT first or something else.
Okay.
He's also recommending to have a steroid shot.
Okay. You had that or not?
I did not do it
Okay.
because he said it's not advisable for the hips.
For the hip. Okay.
Yeah, so I don't have any steroid shot
Okay.
yet, but I did not go back to the orthopedic surgeon
So you had the PT, chiropractor, any other treatments?
for almost 2 years.
Yeah, 2 years. Wow, that's a long time.
Yeah, and
you
then
had massage or anything else?
I do my body massage also, chiropractor like twice a week,
Okay.
and then I go to the exercise
Okay.
place. They are stretching it.
Okay. So your pain is it constant or comes and goes?
Constant, especially
Constant.
at night.
Okay.
I only sleep for 3 hours and
Okay.
then couldn't sleep anymore after 1 o'clock until.
Okay. What else is difficult for you because of your pain? We're gonna focus on your hip for now because our time, and then we're gonna work on the knee later. So
I'm having a hard time putting my socks on or lifting my left
lifting
knee.
your leg, like doing
like
this.
that.
Can
Yeah.
you do that? Can you lift it up?
That hurts.
That's very limited. Look at me. I'm lifting my legs up here.
I
My
can.
knee
I
closer to
cannot.
my chest.
I cannot.
See, just she cannot even do that. Okay.
Yeah, and
So that what else is difficult?
I have having difficulty going in and out of the car
Out to what
or
about
getting up
walking?
in the chair.
Sit or stand?
Yeah,
Yeah.
if I walk like maybe 100 feet
Mhm.
or I am on my feet for a long time, it's
Uh-huh.
starting to hurt more.
In the hip area.
Yeah,
You feel it in the joint or outside?
joint.
In the joint pain. Okay. So we'll have you stand up and walk and let me know from 0 to 10 how much pain, okay?
Okay.
So you give me numbers, okay? How much pain with that?
4, 6,
How long you been limping like that?
more than 6 months, I think.
Oh my gosh, sorry about that.
But-
That's not fun.
This last 2 months is getting worse.
Last 2 months is getting worse. Okay, so we'll have you walk back and forth here and tell me how much pain. You're really limping, and that's a very slow gait. So you are limping because of your hip or hip and knee?
I think mostly it's my hip.
So your left hip. Okay, we'll come back. And before this going on, you were walking a lot faster. Is that correct?
Yeah.
Okay. So we'll have you lie on your back. How much pain when you walk?
6.
6 in the hip, sharp pain in the hip. Okay. And he told
it's
me
radiating to my back.
And he
this
told-
one is getting numb.
numbness in both glutes.
Yeah.
Okay. So he told you have bone on bone in your hip.
Mm-hmm.
Okay. All right. So we'll have you lie on your side, on the good side. So make sure everything pain-free, okay?
Yes, Doc. Do you want me to loosen
Yes,
this?
please. Loosen up a little bit. So it starts with the hip, and you start to have back pain, you start to have both knee pain.
Yeah.
Sorry. Okay.
No, it's okay.
How's that?
Good.
Okay. Don't scream, okay? Not in the front of the camera. Just let me know if it's painful. You feel the tightness here? That's a very tight fascia.
Yeah.
You're familiar with the fascia system, yeah?
Yeah.
Okay, the superficial fascia layer is wrapping the entire body, very thin layer under the skin wrapping the entire body.
Mm-hmm.
So fascia restrictions, it's like you're wearing a t-shirt 2 to 3 size too small.
Mm.
So it compresses on everything underneath it. And it could compress on nerve and artery and cause nerve pain. Is it too much?
No.
So you said you did stretches and exercises. How does that feel?
It's okay, but it hurts.
Okay, if it's painful, what does that mean? That aggravates the symptoms, so I will avoid anything painful.
That's why I did not exercise
Yeah.
today, Doc.
We need-
Yesterday I exercised a little bit.
Don't hold on exercises. Because think about this way. Pain is like a check engine signal in the car, signal light.
Mm-hmm.
When the light is off, that's an indication something wrong. Okay?
Mm-hmm.
You have two options when you have pain. First option is cover the light, drive, and hope for the best.
Mm-hmm.
I really don't want to drive with you when you do that. The other option is stop the car, fix the issue, and the light will disappear.
Mm-hmm.
So if you do exercises that actually cause more pain, it's like you driving your car while the check engine signal light is on, which means you might cause more damage. Does that make sense?
Yeah.
So that's why I don't recommend painful exercises or motion, because you don't know if that's gonna make it worse. You know what I mean?
Mm-hmm.
And you said already you've been doing that for 2 years,
Mm-hmm.
which means you still have pain, you know? Is that too much what I'm doing?
No.
So your pain right here in the joint?
The Doc, this one.
In the front too?
Yeah.
Okay, sorry.
This one here in the
Okay.
middle.
In the middle. Have you had any surgeries?
Hysterectomy.
Okay. Do you have a lot of scar from that?
I have it in here in the
front?
middle, below my belly.
Okay.
I also have cataract.
Cataract? Okay. So it's gonna feel cold, okay?
Yeah.
I'm gonna work on your scar tissue. You feel this bump here?
Mm-hmm.
That's a scar tissue.
True.
Is that painful?
No.
Okay. Here? You feel that?
Yeah.
Is that painful or it's okay?
When you, it's not. It's painful, but it's okay.
If you feel pressure, that's okay. If you feel pain, that's not
Yeah.
okay. Okay? If you don't have a scar tissue, it should feel like nice and smooth like this. Feel that?
Mm-hmm.
Compared to this grinding. You feel that
There's a
grinding?
lot there.
Yep, you feel that grinding like washboard, like on the sand, or like a little
Yeah.
bit, like small pieces of rocks. Those are scar tissue. Feel that?
Mm-hmm.
Because think about this way. Anytime you have abdominal surgery or any surgery, I'm going to show it to you on my clothes, okay?
Mm-hmm.
So let's lie on your back. I'm sorry. So, bend your knees and relax. Okay. So when I have abdominal surgery here, okay, this is what can happen.
Yeah.
Okay, look in the back. It's
Yeah.
tightening. Is that gonna cause back pain? Oh man, that's really big
I
surgery.
think I did it twice here.
Oh,
The same
wow.
surgery in 1980 and 1987.
Wow. I know, it's hard to see. That's a big scar.
Yeah.
Take my word, okay?
Actually, they removed the previous scar. The doctor
Is that
said.
okay? I will work here?
Yeah.
Okay. Is that too much?
Mm-mm.
Why you had hysterectomy?
I have a big fibroid on my ovary.
It was benign?
Yes.
Okay.
They removed my left ovary. They did a total hysterectomy. They did a explore lot.
That was a long time ago, yeah.
That was 1980,
Oh man.
and then 1987
They usually don't do that, like big cut or
because that was 87 though.
Yeah, it's not.
Now they don't do it anymore.
Yeah, I'm sorry.
They
That's a
do
big scar
vaginal
tissue.
now.
Is that too much?
Uh-uh.
How does it feel?
It's okay.
I'm not using my hand, I'm using the tool. Okay? Make sure it's not too much.
No.
Sorry. It's a very hard scar tissue. And this
Yeah.
is the side, yeah. Sorry. Is that painful here? Yes, no, both.
It's okay.
Pressure is okay, pain is not okay. Make sure you tell me, okay?
So just press you.
Okay, I'm gonna work a little bit on the scar tissue here. So that scar and that my pulling on the back. I had a lot of patients with chronic back pain and
Because
hip pain because surgery is in the front.
uh,
And unfortunately, a lot of healthcare providers, they don't even look in the front and they don't connect the front with the back. And
nobody look at that.
yeah, well, you have to have a special training to work on those areas. And you have to have a tool to break the scar tissue.
And you know,
If you depend on your hands, good luck with that.
some of the doctor only spend 10 minutes with the patient.
So, the scar tissue, we can get rid of it. Some patient, we can get rid of the scar tissue for those patients in one treatment. Other patient could take several treatments. Depend on several factors. First is genetic. Second
It's
is,
been long time.
well, that's another reason. The third reason that's more important is the imbalance between calcium, magnesium, K2, and D. If someone has imbalance between those elements, like those minerals and vitamins, the scar tissue is going to be very hard. We have to balance that so the body resolve those scar tissue. That's why we do nutrition evaluation. Because if you have that imbalance, it just, your body, the tool is going to help to break it, but we need internally to decrease it. Does that make sense? So we'll have you walk and tell me how's your hip feel. Let's cover your mouth. Let's put the mask on, please.
Walk here,
Yep. How's your hip?
much better.
0 to 10. I think you used to say it was 6 out of 10 before we start.
Yes.
How is it now?
There is no pain, but it's heavy.
It's heavy. Okay, that's a good sign. No pain. Okay,
It's not painful.
Hmm?
It's not. There's no pain.
But you feel heavy. We need to drink a little bit more water to flush the toxic we just released. Okay. So heaviness. I'm gonna use the magnet. No seizures. You don't have seizures.
No.
Okay. So we'll have you just sit.
Sit down.
Yeah, let's sit in your chair actually. Okay, it's your left hip. Yeah. So I'm doing it that in this position because the table is a little bit high, okay? I don't want you to go up and down for now, just to save some time. And where do you feel the heaviness? The whole thing or the front, the back?
The pain
The heaviness when you walk now?
here.
In here?
Mm-hmm.
Okay. So I will have you, I did not use a magnet initially just to rule out is it more proliferation or inflammation proliferation. So now we know from heaviness you have a little bit inflammation. I don't know if it's mild, moderate, or severe.
Mm-hmm.
That's why I use a magnet as a diagnostic and treatment tool. So if you feel it's back to normal in just a few minutes of using the magnet, that's a sign you have a mild inflammation. To moderate to severe, I usually recommend you use a magnet for several hours or several days. Depend on your inflammation. Okay?
Mm-hmm.
Let's stand up. Do you still feel heavy or no?
No,
It's gone or you still feel it?
a little bit of pain here.
Okay, let's actually put this magnet on that spot. We just put the magnet on the spot that you have discomfort in. We'll have you walk back and forth and tell me how that feels. You don't have to hold it with your hand, you know.
Oh,
How does that feel?
okay. I feel better.
Okay, let's take your shoes off and I will have you walk back and forth. Any pain or it's gone?
There's no pain.
No pain.
Just a little heavy here.
Heavy. If you start to feel a warmness, that's indication a lot of inflammation in that spot. So we'll have you walk back and forth and let me know how that feels. Your speed a little bit improved. I know you're still limping, but that might be because you have knee issue and we did not work on your knees. But you're walking a little bit faster now. How's that?
And I don't put too much pressure on my
Yeah.
left.
How is the heaviness?
It's okay though.
Okay. If you feel you can walk a little bit faster without discomfort, go ahead on guard. I know you've been walking like this for a very long time, so we need to change that habit. How's that?
Yeah, I can.
You see how many times she's going back and forth? We started as just one time. She was in a lot of pain. Okay, the other test we're gonna do is we'll have you sit to stand. You can sit to stand on that chair over there.
Here.
Yeah, because that was painful before. Actually, before you do that, knee to chest.
It's still hurting.
It's still hurting, so we're gonna do that later.
I
Okay.
cannot live.
Yeah, we're gonna do a little bit more work on that. Okay. So we'll have you stand up.
Do I need to put pressure?
Whatever make you feel comfortable. We still need to work on your knees too, so we have some work to do. How you feel?
A little wobbly.
Yeah, you're very weak. You have not been walking normally for
No.
several years. Yeah.
And I'm so guarded to walk
Well, it's
because like I'm gonna fall if I don't make it, if I'm not careful.
yeah. So you had physical therapy, chiropractor for several years,
Uh-huh.
and we just had a few minutes of ASTR treatment. Can you tell any difference?
There's a big difference though.
Mm-hmm.
The pain,
Uh-huh.
there's no pain, just heaviness.
Heaviness because of
And
inflammation.
I can feel that I can walk better
Uh-huh.
and there is no more like limping.
Limping, so the limping decreased.
Yeah,
Yeah, awesome. Yeah, thank you so much.
you're welcome.